Welcome to the office.
Hi.
Hello.
Welcome to the office.
Thank you.
How can I help you? What you doing here?
My back.
What's wrong with your back?
My mid back hurts really bad.
Your mid back hurts.
Yeah.
What happened?
I think if I had to guess, it goes back to a major car accident that I had. And it started off with
How long ago was that?
10 years ago.
10 years ago. Driver or passenger?
Driver.
Okay. So a driver of a car you rear-ended or you got rear-ended?
No, I was going way too fast on a really sharp turn.
Okay.
Tried to hit the brake, ended up coming off of the road and slamming into a rock.
Okay. By yourself?
By myself, yeah.
Wow, okay.
Totaled. Didn't get the car back.
Emergency?
No.
Ambulance?
No.
You left on your own?
I got picked up.
You got picked
up. And then
by friends, family?
By family.
Okay.
Yeah.
Right.
And so I try to just like suck it up and be okay.
What did you hit?
This knee, this right here, and then I have the seat belt scar.
Did you get any imaging on your knees?
No, I was being a baby when it happened, and they wanted me to get stitches because they suggested it was that bad, but I refused to get them.
Why is that?
I'd never gotten stitches. Now I have stitches on my forehead, and
now
it wasn't that bad. Yeah,
okay.
I wish I had done it because now I have this terrible scar. They did the like the skin adhesive type of thing.
Okay.
Yeah, so.
But did they take imaging to see anything was damaged inside?
Did I remember? No.
Okay.
No imaging.
Any x-rays of your back?
No.
Seriously?
Yes.
How do you total a car and get no imaging? This wasn't a personal injury case or anything?
No.
So you just, after the accident, you got insurance took care of the car? You had any treatment?
No, nothing. It was just the skin glue and then just be on crutches, and for most of the day I would just lay down and have my legs straight to make sure that the skin wouldn't open back up. But that was really all of the healing.
Is your knee bothering you right now?
No, it's this knee that bothers me, and it only bothers me when I work out. If I'm really focusing on my form, I'll feel like the pull, like naturally it wants to go inward.
Rewind. You're doing what workout where you're concentrating on your form? Like
squats, deadlifts.
Squats, deadlifts.
Yeah.
What kind of weight are you doing?
Moderate, not too heavy. I used to lift really heavy, and then my back just got worse and worse, and now I've gone a lot more moderate. I don't push myself.
You want to go heavy again?
I want to. That's why I'm
really
here. Yeah.
Oh, that's why you're here?
For the most part, yeah. I would like to be active for the rest of my life. Yeah.
Okay.
Forever.
And you have limitations right now.
I feel that way, yeah.
And the first limitation is you're compensating your body.
Yes.
You understand that?
I can feel myself compensating, yeah.
So when you're doing squats or deadlifts, you have to change your feet, your hips, or your knees?
Hips for sure. I feel like I have to focus really hard on holding my posture up.
Okay. Because we're gonna test this.
Yeah. Okay.
I'm gonna have you do it. I have a little 5-pound bar.
Okay.
That's about as much as we're gonna do.
Okay.
And we'll have you do a squat.
Okay.
And a deadlift. Watch the form.
Okay.
Then later on, after some treatment, we'll take a look and see what's changed.
Okay.
Okay.
Yeah.
All right. Cool.
Yeah.
So you're modifying, compensating in your workouts for 10 years since the accident?
It's gotten progressively worse. I feel like in the last maybe like 4 years, it's gone a lot more drastic.
Okay. More drastic meaning you have to compensate even more?
Right.
Is there pain after the workout? Typical soreness.
I would say yes, pain. Yeah, after the workout, I can feel like tightness, a lot of tightness.
Not tightness or stiff?
Tight.
Okay.
Tight. Stiff in the mornings.
Okay.
Yeah.
That's part of the answer. Okay.
Yeah.
Okay, what else?
Started with my mid left back. I remember feeling really, really tight. Like I thought that I had pulled something, so I went to a doctor. And all they did was prescribe muscle relaxers and they suggested that I do physical therapy.
Sure.
And at that point, like, I felt like I wouldn't function on muscle relaxers, so I decided not to do that.
Okay.
And just did like stretching type things at home.
Okay.
And then that didn't do anything, so then I looked into a chiropractor. That's when I started going to the one in town. It felt good for like initially and like for a few days.
Okay.
But then it would just come back. So I would go for like
exactly the same.
Exactly the same.
Anything get worse?
It would not immediately. It's just progressively through the years. But I feel like it's just because I'm not letting myself. I don't know. I'm not letting myself rest. So I'm compensating, and it's just like I said. Like it started in my mid back, and then it just started spreading, like to the point where I feel like my neck, my shoulder,
left side.
All left side.
Everything is left side.
Everything is left side.
Okay.
The only thing that I feel on my right side is not very often, I'll get like a sharp pain in my rib. Like pretty much like
right
around
side?
here on my right side. Just that one. Okay. But everything else, I don't have any symptoms.
And I'll take a look at that. I'm going to ask you you don't have to answer this.
Yeah.
Where were you driving when you got in the accident?
What city?
Where were you going?
I was getting off of work, and I was going to pick up my little sisters, and we were going trick-or-treating.
So it was Halloween.
And they had extended me that day because we were so busy. And so in my mind, I was late to go get my sisters. So I was rushing home. Bad idea.
And you were okay leaving work. You realized you had a lot of work.
Yeah.
But you had to leave for family.
Yes.
And you were fine with that.
Yeah.
Okay.
Yeah.
But
yeah.
You rushed it.
I rushed it.
Okay.
Really rushed it.
And did you still go trick-or-treating?
No.
So, there's your lesson, guys.
Did not, no.
Okay. And if you could go back and look at it, what would you have done differently?
I would have slowed down. I would have looked at the road.
Because rushing it didn't make it any better.
Yeah, no, not at all.
That's
now
good.
I'm here 10 years later.
That's right.
Yeah.
I think other things are going to happen out of this visit, too.
Yeah.
So, we'll see. Okay. Mid-back, low back. Anything shooting down your legs?
Just like the sciatica that I get sometimes. Like
so you are getting sciatica,
yeah.
shooting pain down.
Yeah.
Left side, the back of the leg, the side of the leg.
Ooh, side.
Side, down to the knee, past it, or down to the toes?
Sometimes it's down to the toes. I have to be like on my feet or sitting for a really long time for that to happen.
Big toe, little toes. Big side, small side.
Ooh. I would say more small.
Okay.
Yeah.
Okay. What else?
I've noticed, like, if I'm laying down and I'm on my phone and if I even do this starts to go numb. My pinky. If I hold it up
What
for
if you just
too
do
long.
the right side?
I don't. Mm-mm.
Nothing in the left pinky?
No.
Nothing in the left pinky?
This one, like, I already
Keep
feel.
it down.
Oh, okay.
Raise the right. Anything in the left pinky? In this pinky?
A little bit.
Turn your head to the right. Anything in the pinky?
It goes away. Oh.
Turn it to the left side.
Yeah. I can feel it.
You feel it, right?
Almost like a little throb too.
Now, okay, feel it?
Uh-huh.
We're not even at the left hand yet. Turn your head, tell me when it stops.
Like about here.
Okay. That's showing you the side slip rotation of the T2. That's part of this. Okay, raise your left hand now. Or no, like.
Oh, okay.
You feel it?
Yeah, it feels tingly.
Turn your head to the right. Less, more, or same?
I would say actually the same.
Okay, turn to the left side.
More.
More.
It starts throbbing.
Okay, look straight here. Look up at the ceiling and turn left. More or less?
A little bit less.
Okay.
Yeah.
Up and to the right. More or less?
That's hard to do. And
you're stuck, right?
Yeah.
Okay.
I feel stuck, and I'd say a little less.
Okay. Look down at the floor. Down into the left. Sorry, down into the right. More or less?
Less.
Okay, down and to the left.
More.
More. So everything is left-sided. Down to the right helps it a little bit more. Yeah?
Yeah.
Okay. Now, hand down. Look up at the ceiling. Turn to the left. You feel it?
No, not really.
Aha. Turn to the right. Feel it?
Yeah. Yeah, I do. It starts to throb a little
So
bit.
now you don't have to raise the arm to do it.
Yeah,
Okay.
if I'm looking up.
Correct, up and to the right. And are you ever in that position?
Not unless I'm like looking at something in the sky.
Stuff,
Yeah.
Okay, we're getting some answers. Good.
Interesting.
Okay. Fascinating.
Yeah.
Okay. Digestion.
I wouldn't know how to gauge it, but from watching your videos.
Okay, so from watching my videos, is it dark or light, or does it sink or swim?
I would say for the most part sink and...
Changes color based on what you eat.
Yeah.
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 Okay. All right, we'll talk about that stuff later too.
Okay.
Okay?
Okay.
Number one reason you're here is the low back and mid back pain.
Yeah.
You're getting
Mid-low.
this shooting down, but you're also getting this numbness in the pinky, which is significant also.
Yeah.
That's actually more significant.
Really?
Yeah, because you're losing sensation.
Interesting.
And the basic exam I did is telling us it's coming from the lower cervical, upper thoracic as part of it. But it's whatever we find, we find.
Okay.
Yeah?
Yeah.
Okay. Okay. Anything else?
I always feel, I'm sure it has to do like with that also with my neck. I always feel like, not like water in my ear, but like it just feels like, it doesn't feel the same as this side.
Like a swishing sound?
It's not a sound though, it's like just like a
muffled
feeling. Kind of, yeah, like muffled.
Like maybe you're speaking underwater on one side and not the other?
Yeah. Some days is worse than others.
Okay. You had any ear infections in the past few years?
I used to get a lot when I was little.
Oh,
I had actually tubes put into this ear, but
You
not
did?
this year. Yeah, I had tubes put into this ear.
On the right one?
On my right one.
Not the left one?
Not the left
Why?
one. I was out at the beach when I was younger and a wave crashed onto my ear and it bursted my eardrum.
Mm-hmm.
So I had to get that.
So they fixed the eustachian tube on the right?
Yeah.
Got it, okay.
Yeah.
Okay. Is it affecting your hearing at all?
I feel like I have pretty bad hearing to start with. I used to go to music festivals a lot and I didn't wear the proper ear protection, so I feel like that...
So you were just dancing on the speaker?
Basically.
How about the nose? Breathing?
I got punched in the nose really hard one time, so I feel like my nose isn't right. Yeah.
Is it affecting the breathing though at all?
I wouldn't say so. No, I don't wake up like out of breath or anything.
Okay.
But if I like do breathing on either side, I notice that one is different than the other. Yeah.
Okay, so we can take a look at that also.
Okay.
Later. Okay.
Okay.
Primary focus is figure out your foundation and why you're feeling this.
Yeah.
Okay. Let's get some answers today. After that, well, let's go over your x-rays first.
Okay.
After that, I'll watch you walk. We'll do the exam. We'll figure out where we're going to start.
Okay.
And you're here for about a week.
Yes.
Let's start the journey.
Let's do it.
You ready?
Yep.
This is a picture in time. Okay. We have 24 bones in the spine, 23 discs in between. This is the foundation of the entire spine. This is a picture in time that tells me how you evolved from birth, right? This is the side profile. On the side profile, we're looking at the curvature and we're looking at the discs. We'll get to that in a second. Let's start over here. You've watched my videos, you know kind of how I go through this, and the number one thing here is what?
The foundation.
The foundation. So, we will address the foundation in just a minute. Think of this as a 24-story building. In order to have a stable building, we need a level base and foundation. A lot of your complaining is starting in the mid-back though. Okay, and I'll explain that on this x-ray why that's happening. If we're going to go over your curvature actually first. And on the side x-ray, we are designed to have 60-degree reciprocating curves. So the first thing is, do we have those curves? We actually have less curve. And in the mid-back, it's flattened through, and you can see also a straightening of the neck. The question is, where did that come from? Number one. Number two is the posture on this x-ray. And when we're looking at ideal posture, let's say you're standing on the side, they used to do plumb lines. And plumb lines are, they take a string, the ear lines up with the shoulder, the hip, the knee, and the ankle. I do it on x-ray, take L5, run the laser level through. It should bisect 7.1 and up here. So it should bisect between C7, T1 and C2. Okay?
Okay.
And what do we see?
Does not.
It does not. Let me just redo this one here. This one goes C7. So we're off about this much here and here. What is the consequence of that, Stephanie, is this. Your upper body is behind the foundation of the building. So these muscles in the mid-back here, this whole area, are working off balance just to keep you in balance. Does that make sense?
Yeah.
Okay? So that's that's one of the reasons you're getting that mid-back. It didn't start there. Now, let's get to the foundation. And there's a couple of things here, but it's a little misleading when you just look at it without marking the x-ray. And what does that mean? In the level foundation, we're looking at first, is there misalignment of the pelvis and or the sacrum? So the way the pelvis works, it works in opposite. One goes up, other goes down, one goes in, other goes out. Yes? Okay. You don't have misalignment of your pelvis up or down. First good news. You don't have misalignment sideways of your pelvis. Second good news. So where's it coming from? Sacrum. Even in your sacrum, there's good news. We don't have rotation of the sacrum. So there's not a rotational component in your misalignment in your foundation. That's actually good news. Okay. Now, let's go over here and I want to explain this and this. The one thing I am getting, and it is significant enough, is this. We have 4 millimeter inferior sacrum on the left side. It's tilting on that left side. And I need you to see this. I circled it down here. It goes like this. It goes like this. And like this. It's bending.
Yeah.
Do you see what I'm talking about? So the tailbone, instead of being straight here, it's doing this. And it's causing a 4 millimeter difference between left and right side. And what that has done over, that's why you're off balance. Follow me. Check it out. Let's say you're doing a deadlift. I'm over-exaggerating the movement. Let's say it's supposed to be like this, right? Yours is like this. Because you're down on the left side. So then you're having to compensate that right side.
Yeah.
Make sense?
Yeah.
Okay. And all of this is coming from the sacrum on the left side. Let's look over here. When we look at the sacrum, it should be a smooth arc. Yours is okay here. There's that nub. So there's a nub there, and then coccyx. So you've had at least 2, maybe 3 good tailbone injuries growing up, whatever that is. Okay? And that's probably where we're going to start in the foundation after we check you on the exam.
Okay.
But that's what we're seeing. That's what I'm seeing here. Does that make sense?
Yeah.
Okay. Now from here, and here's the good news. So the research tells us, and all these books will have different things. This is the sacrum. It's 5 pieces or 5 tubercles that ossify or complete maturation. I don't want to use the word calcify. Calcify means it's not normal. It matures at about 32 to 34 years of age. That's the good news also. Mm-hmm. So whatever we can try to do, we can try to do it now. Okay?
Okay.
So we have something S3, S4 down low, tilting on the left side. After that, let's check the rest of the spine and let's see what's happening. So if this is our current level foundation, next one to go off level is 5. Okay? So 5 is tilting. It's tilting this way. If I fix 5, I can push 5. I know there's going to be tenderness. I can see it here. But if I just do 5, I'm adjusting 5 on an unstable base. So what do you think is going to happen?
It won't last.
It's not going to hold. So just adjusting it one way or just hitting that L5 to get a pop sound doesn't fix the issue. Make sense?
Yeah.
Okay. 5 is the first one to go off, the foundation from the sacrum. 2 comes back to level. Next one to go off is L1. L1 takes this whole part of the spine over to T7. This is what you're feeling. Now, what if I adjust 1? L1 is tilted up. I adjust it down. What's it going to want to do? Go right back up. Why? Because of a dropped sacrum. This is all compensation. Sorry, it's there, but it's all coming from what you're getting. Okay? Now, 6 is the next one to go off. This is your digestion area. Make sense?
Yeah.
Now, why did I ask about digestion? I'm looking here at the Blvd. It's a little small. It should be this big. This is the gastric air bubble. And then I see stuff here. Okay? That's what I see. I see stuff in here too. It's light and subtle. It's not a hard fix for you. It's not. You just have to do a few lifestyle changes and get the power on. Okay?
Okay.
From there, this is what you were feeling with the turn. This is the T2. This is something else, and I do need to discuss this because it will be a little bit spicy. T2, this is a side slip. This is a separate trauma. That could have been a car accident. But it's right here, right there. So whatever happens, something happened. It's sharp if I touch in there.
Yeah.
Okay? So you had some trauma to that T2 separate from the other stuff, or it could have been with one of these injuries. T2 side slip is throwing the whole neck curve off. So your neck is actually starting here at T2. T2, T6, L1, L5, sacrum. Those are the majors I'm seeing. Again, it's just an X-ray. Doesn't mean I'm adjusting 4 or 5 things. Mm-hmm. It's what I find on you. Mm-hmm. Okay? Now, let's look here. Let's give you all the good news now. So, side profile, we said we want 60-degree reciprocating curves. First thing is we don't have those curves, but what is the condition of the disc? That's a good disc. They should be level. They're designed to be level. Okay? You see this is tilted, but the discs are fine. Your L5 disc is fine. It's a little thin in the back, but for all intents, it's fine. What do I mean by that? If we look at the shape of it, it does tell me something may have happened about 7 to 10 years ago. Okay? However, you still have good disc there. And anatomically, L5 is going to be slightly smaller than 4, 3, and 2. So there is a misconception. People will look at an L5 disc and think it's thinner. It's not. It is anatomically smaller than the others. Okay?
Okay.
But in your case, that pinching, those symptoms you're feeling is coming from starting here, and it could be here. L1 can also cause sciatica. Okay? It's something in whatever's off balance. And the last piece of the puzzle here is coccyx. That was falling on your tailbone. You snowboard? Mm-mm. Ski? Any of that? Mm-mm. Okay. You'll figure it out.
Yeah.
Okay? You talk to your mom, dad, whoever, and you guys can figure it out. These discs are fine. These discs are fine. Okay? It is a little thinner on the 4, this area. So what's happened is because of these things, you have a lot more flexibility. You get a lot of pops and cracks there back in the day. I'm assuming.
Yeah.
Okay? A lot of pops and cracks. So this one became hypermobile. This one is worn out a little more than the rest. That's T4. Okay? T3 is good, 2, 1. Your neck discs or your discs in your neck are good. There's a tiny little bit disconnect here. You probably get pops and cracks in the neck as well. You can make your neck pop? Mm-mm. No? Mm-mm. Oh, good. Let's see if I can. Jokes aside, any questions on this? Does it make sense what I'm showing you?
Yes.
Do you have any questions in the foundation in any of the x-ray?
Is there anything wrong with my jaw?
Jaw is off too.
Yeah.
Good call. So, I didn't go upper, higher because of T2. Okay, but when we're looking at it, we're looking at deviation of the jaw. This is the middle. the symphysis will deviate away from the problem side. So if we look at the center of the jaw here, which way is it gone, left or right?
That way.
So the issue is then the
Left. Right?
And the left compensates.
Oh.
So you can get symptoms on your left, but it looks on the x-ray, I'll check it on you, it looks like the right goes off and the left compensates.
I mean, like if I open my mouth, my jaw's coming over this way?
It goes from right to left. I'll show you one example.
Okay.
But it should go from right to left and then come back left to center is what it should do. We'll see.
Okay.
Whatever it is, the x-ray says that though. The x-ray is telling me it goes this way, compensates back. Okay?
Okay.
You ready?
Ready.
Let's look at the posture, the gait, and see what's going on. So first thing we can see is what? The right scapula is higher than the left. When we look at the musculature, you can see this is a little more pronounced than this side. If you look at the V, this is okay. This is symmetrical. This comes in a little more. This has a little bit more muscle tone. When we come down, I want you to see the sacrum. Look, this is swelling from the sacrum. I'm doing this on purpose, okay?
Mm-hmm.
Before and after for us. So this is swelling from the tailbone or the sacrum. Now, we want to see the dimples. When we look at the dimples, this is the right dimple, this is the left dimple. You can feel this one is slightly higher, this one is slightly lower. Do you feel what I'm doing here?
Yeah.
Okay. What we're going to watch is how do the dimples move? How does the overall spine move? How are the feet moving as well? Go ahead and walk to the nervous system poster and back several times, please. And as you're walking, you let me know what you're feeling first right now as you're walking. Is anything twinging in your mid back or your low back? Keep walking, please.
I mean, I feel like today's a pretty bad day because I drove.
Okay.
So I feel a lot of pain in my back right now.
Okay. A lot of pain in that low, mid, or both?
More in the low right now.
Okay.
Still tightness in the mid back though.
Okay.
I always feel really imbalanced when I walk. I feel like I almost not calculate, but I think
you think about your walk.
How I walk, yeah,
yes.
To find like the less painful way.
Okay, keep walking. Walk to the nervous system poster without thinking so much. Just go walk and touch it. So you can definitely see that in the tailbone. I'll explain it in a second.
Trying not to think about it.
Yeah. You can. Here's what I want to show. Come over here, please. Two things. Turn around. So what I want you guys to see is this. When we're looking here, this should go like this, up and down, up and down. It's doing it here. Mm-hmm. Okay?
I've noticed that.
All right, so this is all stuck here. And so what's happening is the movement is starting up here. That's what I'm seeing. Is that what you're feeling as well?
Yeah, I feel a lot of tightness right there.
Okay. I want to see this. Okay? And this next walk, I want to see you swing your arms. Okay. Swing your arms, please. Yeah, everything's binding. So because that tailbone's not moving, everything's kind of happening at L4 and L3 right now. Walk on your toes, please. You wear heels?
Not really. I used to, and then it started really hurting my sciatica. Like just like a week ago, I wore heels for like 3 hours.
But you walk like you wore heels.
Yeah.
You didn't wear heels a bit?
Mm-mm.
No? Okay.
No, it's been
ballet? Dance?
Nope.
Okay. Walk on your heels now, please. This is interesting. She walks better on her heels than normal. This is complete opposite. So your back looks better when you walk on your heels, which is completely opposite. Now
really?
That's interesting. Walk on your toes. Check it out. You can see that kink on the right side when she does that. Okay, regular walking towards me. One more thing. Turn around, walk on your heels, please. Watch here. That's a little more symmetrical, but when she's walking normal, regular walking. One more time, please. Okay. March in place in the middle of the room. Close your eyes, keep marching.
Just it pops.
Yes, ma'am. You see, she's just kind of wobbling back and forth. It's not stable. It's not balanced. Yes?
Yeah.
Have a seat, please. You ready?
Yep.
Let's check the jaw.
All right.
I want you to sit up straight. You can sit forward so your feet are on the ground. Good. And look straight ahead here. We did talk about the nose and we can see. Slowly lower your jaw. From right to left and then left back. Okay? Watch. But even before that, just open slow. Stop. So the lips here go straight. These go that way. Do you see that? This lower jaw is actually, instead of being like this, it's slightly like this. Now open. So it opens, it goes like this. And then it comes back. Now, do that again, please. Open. Yeah, this side comes out. Do you feel that? Mm-hmm. It's this right side comes out first. Mm-hmm. Left side is the compensation. So we have right AI, left EX compensation. We'll deal with that along the way.
Okay.
Okay? Okay. Most important thing today is what?
Mid-back, lower back.
Your foundation.
Foundation.
Foundation. You can keep mask on or off now. It's your choice.
Okay.
Sit back for me, please. Now, starting at the base of the neck. And so it looks like it's breaking left, looks like it's breaking right, looks like it's breaking left. And where is it coming from? Up top. The needle's just doing this. So all this is compensating from C1 or lower. Now you get breathing anxiety?
Yeah.
More difficulty taking in a breath or exhaling?
Inhaling.
Inhaling.
Yeah.
And then you start holding your breath a lot.
I hold my breath so much.
So guess what part of your homework is going to be here? You've watched what I do.
Breathing exercises.
Yes, ma'am. Breathing exercises. What does that mean?
Holding.
It means you're going to give you a list of exercises to do, okay?
Okay.
T6, T7, left side. 10 points. We have T2, C1. T6, T7. Left side, huh? 10 years ago. Mm-hmm. Okay, now as we get to the sacrum, there it is. S3, S4, right there. S3, S4, T67, T2, C1. Static palpation now, starting at the base of the neck. Let's see what we find. Took you a while to get here?
Yeah. 5 hours.
Shasha helped you, the booking and everything?
Yeah.
T2. Now watch the swelling as it goes down. It gets orange peely right there. And then it goes, starts to sink in back to the center, but it's still there. So that swelling is going all the way down, stops a little bit there, keeps going, and this whole side is inflamed. Look, from here, all of this.
Yeah, I can literally feel like it protruding more
and
than
it's
the other
all
side.
So you have left all the way down. If I do the right, check this out. Different, right? To you.
Oh yeah.
Different.
Yeah. It feels just normal. The other side feels swollen.
Scoot forward, please. Let's check the movement in the pelvis. Feet together. Open and close the knees. Open and close. Right side only, please. Right side only. Left side only. Yeah, so when she's doing the sides, that's fine. Do the right side. Fine. Left side only. No issue there. Scoot back for me, please. Let's check the movement L5 down to S4, S5, okay?
Okay.
Starting at L5, all the way back, a little tender.
Mm-hmm.
Okay, and that's what I was showing you on the x-ray. That's 5.
Yeah.
Okay, S1.
Less than the other one.
S2.
Mm-hmm.
S3.
2 feels more.
S4. Not so
like
bad.
2. Yeah,
That's
one.
3.
Ooh.
That's 4. Let's do that again. That's 3.
3.
That's 2. 2 also a little bit.
A little bit, yeah. But
One
number
more.
3 for
3.
sure.
3 on the left. 3 on the right.
The left.
3 in the center.
That hurts.
Or 3 in the left.
The center.
Center, yes.
Yeah.
Okay. Sorry, I'm poking around.
It's
a little
okay.
bit, okay? Now, top of the joint, middle of the joint, bottom of the joint. No pain, right? I'm on the SI joints. Top of the joint, middle of the joint, bottom of the joint. Finger pressure.
Yeah.
Okay. When we go up into extension, turn left. This is the lower cervical spine. Okay? Good?
Yeah.
Little tender there.
Yeah.
Head down, please. This is the upper cervical. Left.
Tough.
Tough. Now we have to decide, are we going to do this one? Or are we going to do this one? I'm going to figure it out in a second, okay?
Okay.
Let's go on your back and let's check your knee. So what you can see right away is there's a lot more swelling here, okay? There's a lot more swelling on this, the right knee versus the left. We're going to do valgus varus stress. I'm on the right knee, and we're feeling for gapping. So it gaps more on the outside, and if I feel back here, a little more tender here, right there,
Yeah.
or there.
The outside.
Okay, let's go to the other side, please. Gapping. Little bit there too, both sides.
Ooh, that one hurts more.
Okay. Let's check again. Which one hurts more? The left one is more
Feels
swollen.
Sharper.
Sharper?
Yeah. That one hurts too, though.
Okay. And that one. And that one. Left side.
The left side.
So we have left talus, we have left knee, we have right knee.
Okay.
Okay. Now, I'll get into the foot mechanics later. Stand up and walk a little bit and then we decide where we're going to start.
Okay.
Okay. Questions and anything I found?
No.
Did you know that was your issue?
I didn't know what it was, but everything you're calling out sounds like something I've felt. Like the places you're pointing out are places that I've thought didn't feel normal.
Now, coccyx stuff and all that we'll deal with later.
Okay.
Okay, I'm not worrying about that right now. The main focus right now is that S3, number 1. In your case, I'm going to do a little different today. We're going to do just S3. After S3, I'm going to recheck to see between the upper cervical and the T2.
Okay.
Okay? Just to be safe. You ready?
Yep.
Okay. We're going to start off right side down so we can torque the sacrum. S3, okay? We're going to start off here. I want to torque it this way, clockwise.
Okay.
Okay? I think she's going to get a little bit of that cobra action. You ready?
Yep.
Cool. Look down a little.
Ooh.
Home run.
Oh.
Look at that, not me. Look at that, not me.
Holy crap.
Hi.
Hello.
You okay?
Yeah.
Come up slowly. Push yourself up. Swing your legs down.
Okay.
Walk that off. That was deep.
Oh, yeah, that felt deep.
Tell me.
It feels different.
What's different?
It feels more, like I'm like upright, like it's easier to hold my posture, and I still feel a little imbalanced,
Sure.
but
Walk on your toes. Let's watch the. Yeah. Let's watch that. It used to stop here. Now it's going to come down. Watch. Walk, please. Regular walking.
Okay.
Looks like she's walking on her heels in her back now. Walk on your toes, please. A little different.
Yeah, the left side feels different.
Walk on your heels, please. That wasn't really an issue anyway, but that should also feel a little different.
Yeah.
Regular walking, please. Keep walking. One more time, and then let's check it out. Good stuff. So far, so good?
Yeah.
Have a seat, please.
Okay.
Let's continue.
Okay.
Look how you're sitting now.
Like I feel like it's way easier to hold up my posture.
Scoot forward, please. Cool. Let's rescope you and see what changed, okay? Head down. Guess what? C1 is clear. Okay, so we did the S3. That cleared up your upper cervical up top. So we're good there, yo. We still have this T2 issue, and I said T2 is a side slip, so it may be a little spicy, okay?
Okay.
Guess what it did to your mid-back?
Clear.
No mas.
Nice.
Mira. I'm bringing these down, okay?
Okay.
No mas. 0, 0, 0. So T2 is the next one, and just before we do that, let's check something. Check it out. So first, swelling has gone down. Okay? Next, let's check L5. Do you remember what L5 felt like?
Yeah.
Check it out.
It feels like a
Same?
yeah, it's like space.
It
Oh
feels
yeah. Yep.
S1, S2,
That one still feels a little.
S3.
Not as much.
Movement is there. Good. All right. Let's do the T2. T2, we got to do it as a side slip. We got to do it in 2, maybe 3 parts. Let's go face down over here, please.
Okay.
T2 PLS sides. We're going to start off on the right transverse of T2. Is that okay there?
Mm-hmm.
Let's open it up a tiny bit. Good. 7, 1, 2. We're on the right side of the transverse. I'm doing this in 2 parts. T2. That's part 1. And that's the rest. Gotcha. Thank you. And let's walk.
Okay.
Now, as you're walking, you're going to walk a couple of times. Deep breathing. You do realize your feet are different now, right?
It feels so different.
What's different? Please describe the best you can.
I feel like I was walking on the outside of my right foot a lot, and now I feel like it feels like I'm using my whole foot now, not just areas of my foot. And I noticed I used to do that. I feel like I used to like kind of like slouch forward. Now I feel like I'm really upright. Yeah.
Guess what the best news of today is?
What?
You get to buy new shoes today.
Yay.
Because those old tires ain't gonna work.
Yeah.
Okay?
Yeah. Okay.
You've heard me talk about it, yeah?
Yeah.
Yeah. Changing alignment, change the tires, change the shoes.
This was good.
Good. Keep walking one more time. She's a trooper, dude. Sure, 5 hours solo came down and said, I'm doing this. I appreciate that. Have a seat. Rescope and take it from there. While you're here, lots of walking, lots of hiking. You like the beach?
Yeah.
You at the beach then every day if you can.
Am I allowed to walk in the sand?
Absolutely.
Okay.
Walk, run, not run, but walk and no jogging right now.
Okay.
Walking, hiking, swimming is all good. Biking is fine too. Neck is clear. T2 is clear. Mid-back is clear. Sacrum is no mas. All clear. Now let's tune up the rest. You ready?
Yep.
Okay. Ears. Okay?
Okay.
Shoulders. Let me do the work. Let me do it. Gotcha. Over, around, down. That's it. On your back on this side, please. Now, because we did a deep sacrum set today, I am going to start on your ankle, but I'm going to start on the ankle with the board. You've seen me use the board.
Yeah.
Okay? And just to confirm, it's still that side. Compare.
Both, but that one for more.
I'll do both. Raise your left leg. AS talus, medial tilt. Raise your right leg. AS talus, medial tilt. Sit up and turn, and now the buff and polish. Nice. Look, Ma, no mid-back pain. Look, Ma, Doc didn't even touch my mid-back. What you think? Good.
Amazing.
Stand up, please. Squeeze. Squeeze. Come over here, this side, please. Squeeze. Squeeze. Radial head. Distal radius. Lunate.
Oh.
Scaphoid. Ooh, crunchy. You a mouse
Messed
person
up,
or a
messed
trackpad?
up one time. It was in the accident, actually.
That was?
Yeah, I held onto the steering wheel.
Squeeze. You a mouse or a trackpad person? You on a mouse or a
I
trackpad?
don't really use a computer.
Oh, wow.
Yeah, just maybe like 30 minutes a day.
Wow. So you're on your phone.
Yeah.
More communication, I mean. Are
Yeah.
you more like this, or more?
More like this. Yeah.
Okay. Breathe in. Good. Go like that 5 times, please. Squeeze. Squeeze. Good?
Good.
Different.
Yeah.
Questions?
Can I work out?
Oh, hell no.
No? For how long?
This week you're not working out at all while you're here.
Okay. Just 1 week though?
I don't know. I
Okay.
know right now for this week, please no working out.
Okay.
Let's get through this week. I take care of a lot of people that love the gym, athletes, all that. Don't add another variable right now. You're not exercising an injury.
Okay.
We got to fix the injury and let it heal.
Okay.
Right now, walking, swimming, hiking, biking. That's it. No jogging.
Okay.
If you want to sprint, you can sprint. 9-minute mile or faster. Sprint 2 minutes, walk 2 minutes. Sprint 2 minutes, walk 2 minutes.
Okay.
Jogging is not indicated right now.
Okay.
Okay?
Okay.
Good?
Yeah.
You're clear.
Good.
No working out.
Okay. Yes. No working out.
Yeah. You got
It's
it?
under notice.
No working out. Welcome
Thank
to the
you.
office.
Thank you so much.